So good day po, I am Ricardo Eirol. I am your nurse for today. So for verification purposes, may I know your name, your MR number, and your birthday? Okay po, so Mr. Pasay, for today I'm going to teach a post-operative patient in moving to a bed with incision. Another is leg exercises, deep breathing exercises, and coughing exercises.
The purpose of teaching a post-operative patient to move in bed with incision is to prevent complications and promote healing by minimizing strain in the surgical site, while leg exercises aim to prevent blood clot, maintain muscle tone, and improve circulation to aid in recovery, while deep breathing exercises helps prevent respiratory problems such as pneumonia by expanding lung capacity and clearing anesthesia. Coughing exercises assist in clearing secretions from the lungs, reducing the risk of pneumonia and aiding in overall respiratory recovery after surgery.
Before doing anything else, we will discuss the cultural sensitivity of the patient. So patient, meron po ba kayong should I be aware of any cultural sensitivity such as religious beliefs, personal beliefs? Wala naman po. So before anything else, I will provide you some privacy. Do you want me to close the window? Okay, po. So now I will gather off the equipments needed first before doing any procedure. So before that, I'm going to do some infection control, which is I'm going to put some alcohol in my hands to prevent some infection. There are 5 moments of hand hygiene. First is before touching a patient, after touching a patient, before doing a procedure, after procedure, and after touching the patient's surroundings. After the infection control, now I'm going to don a personal protective equipment, starting off with a gown, a mask, a cup, goggles, and some clean gloves. So let us assume that I'm done with donning my personal protective equipment. Let us start off with the procedure. So let us first start with moving the patient with incision post-op. First is the positioning of the patient. First is let us ensure that the patient is lying flat on his back in a comfortable position like this. Next is we will place a pillow strategically to support his head and neck and other areas that might give discomfort or vulnerability to the patient. Next is we will check the height of the bed, making sure that it is in the level that facilitates easy movement to the patient as well as safe movement to the patient. Next po is the communication. First is we will explain the steps clearly to the patient before initiating any movement. So this sa ating po gagawin today is we will do some ankle pumps, some leg exercises, kaya po heads up lang po yun. Next is we will encourage the patient to communicate some discomfort and pain na ma-experience niya during the process. Okay, so next is the moving techniques. We will teach the patient bend his legs while yung feet niya po is flat dun sa floor. So, i-bend po natin. Kaya niyo po ba i-bend? Both legs. Okay. Okay, so now naman po, we will advise the patient to use his arms in supporting his body and rolling onto the other side. Kaya niyo po bang gamitin yung hands to support the body? Okay. Okay, so now we will keep the incision side supported and stable all throughout the movement. And lastly, we will explain to the patient the importance of moving slowly and avoiding some jerky and sudden movement. So, wag po tayo masyadong magalaw sa ating pag-move since it can give straining feeling po sa ating incision. So now, let us now move on with the leg exercises. First po is the ankle pumps. We will ask the patient to sit or lie down in a comfortable position, tas yung leg niya po dapat is straight. Next is we will ask the patient to slowly move his feet up and down. Kaya po move up and down yung feet. Okay po. Okay, so gagawin niya po ito by pushing the ankles below and then pulling them towards the body. Pagawa nga po ito. Okay. So dito po is avoid po natin na excessive na too much na pag-bend since it can cause straining sa incision site. And we will do this 10 to 15 times and at least twice or thrice a day. So next naman po sa leg exercises is the quad sets. Dito po is maglalay down po ng patient natin and then ang legs po dapat niya is extended. Kaya niyo po ba extend? Okay, so next naman po is we will tighten the muscle po sa top ng kanyang thighs or the quadriceps by pushing the back of his knees down. Kaya niyo po ba? And you will do this po, you will hold this 5 to 10 seconds and then after 5 to 10 seconds is i-relax mo natin. Kaya po natin. 1, 2, 3, go. Okay, relax. So now we will focus on engaging the muscle without straining the incision site. And then we will do this po at least 10 to 15 times and then twice or thrice a day. So next naman po leg exercise is the straight leg raises. Dito po is we will ask the patient to lay down po ulit and then one of his leg po is straight and one of his leg po is bent. Kind of bent. And then next po is we will tighten the thigh muscles po by lifting the straight legs sa height po nung bent legs. Kaya po ba ito? Okay po. So, if meron naman pong incision ng patient sa kanyang abdomen or groin area, pwede po natin i-ask na huwag po masyadong i-lift masyado pataas sa knee, sa bend knee na po yung kanyang straight leg para po maiwasan ang straining sa kanyang incision. Pwede naman tayo mag-start ng pa-small movements and gradually increase po natin ang pagtaas ng range of motion niya pag nakaya niya po yung pain or walang pain at all. So now we will repeat this 10 to 15 times and then twice and thrice a day. Next naman po, which is the last for the leg exercises, is the heel slides. First po is we will ask the patient po here to lie down again and then yung kanya naman pong both legs ay nakabend. Okay. So here naman po we will slide one heel sa floor and straightening the legs po as much as possible. So first po muna is one heel, kaya niyo po ba straight? And then straightening it po as much as possible. Now naman po is we will slowly return po yung ating na straight na leg on doon po sa starting position niya. And then gagawin niyo naman po siya sa next leg. Okay. So if the patient po ay merong incision sa may thigh or knee na po is we will advise the patient to do not force the movement. Then we will ask the patient to gently or slowly i-straight yung kanyang heel so that if may ma-feel po siyang discomfort is pwede po niya i-stop mo muna yung movement. So now we will perform this 10 to 15 times each leg and then twice and thrice a day. Next naman po is the deep breathing exercises. Here naman po is we will ask the patient to sit or lie down po in a comfortable position and make sure po na dapat supported ang kanyang body and he doesn't feel any strain sa kanyang incision. Next po is we will advise the patient to close his eyes so that nakafocus po siya sa pag-inward and to block out any external distractions. Next naman po is we will advise the patient inhale deeply and slowly through his nose. Dito naman po is we will advise the patient to feel the air po filling his lungs and then expanding his chest and abdomen. And gagawin niya po to at least 4 seconds or mag-count siya ng 4 seconds. So, hindi po. Nag-inhale po tayo picture. Feel the air po, filling your lungs. So once the lungs are full, we can tell to the patient na mag-hold niya yung air for 4 seconds. 4 seconds. Okay. Okay, so now we will advise the patient na kanya pong muscle is relaxed and yung kanya pong body is still.
So pause before inhaling again. So inhale, exhale. And after the patient has fully exhaled, take a few moments before taking the next breath. So this pausing allows the patient to fully experience the sensation of emptying his or her lungs before taking the next breath cycle. And then, so continue this breathing pattern for a few minutes. Inhale, exhale. Okay, so it is important that the patient stay relaxed, and then throughout the procedure, it is important that the body relax and the muscles are loose. And then in ending this mindfully, so we have to instruct the patient to take a few deep breaths before opening her eyes. So take a few deep breaths po, ma'am. And then when you're ready, you can open your eyes na po. Okay, so after opening your eyes, take a few moments po to notice how you feel after the exercise. So are you feeling okay po ba? Wala naman po kayong ibang naramdaman na pain? Okay, thank you po. Now, moving on to coughing exercise, which is letter A, positioning. So, if the patient is lying, he's on her back, advise the patient to bend her knees and then allow the feet to rest on the bed. So, i-bend po natin yung knees. Yan, okay po. Thank you. And then, depending on the type of surgery that the patient had, if meron po tayong nararamdaman na kailangan po natin ubo, ang gagawin po natin ay gagamitin po natin yung hands natin and as well as to cover it using a small pillow po para po mag-guide po tayo sa pag-ubo natin. Next is moving on to the deep breathing and coughing techniques. So, advise the patient to breathe in deeply through her nose. So, this allows po to the expanding of the rib cage as well as allows the abdomen to move forward. And then hold the breath po for on the count of 3 or 5. So, hinga malalim po tayo sa ilong po. 1, 2, 3. And then exhale po. Exhale completely and slowly. And then, mag-exhale po ang patient dapat through her nose din po. And the patient must avoid forcing the breath out po. So, in terms of bracing the incision naman po, if the patient feels the urge to cough, what she has to do is to use her hands or a small pillow po to apply pressure, gentle but firm pressure po on the wound para po hindi po makasakit kahit na umubo man siya, and to support din po doon sa incision na meron siya. Especially po if ang surgery niya po ay nangyari sa abdomen or sa dibdib po. And then, so during the procedure po, we must also do the assessment. So what we have to do po is to assess the patient for any signs of distress or increased pain during the movement that we are making the patient do po. As well as, it is also important to assess the site of incision for any redness, swelling, or any drainage after the movement is done po. So, for the nursing considerations naman po, what we must do is review the prescribed pain management plan with the patient, and if necessary, encourage the patient to take the prescribed pain medication po before doing any movement. And then, we must also discuss to the patient non-pharmacological techniques na pwede po natin gawin during the procedure or even after the procedure. So, pwede po tayong, kung meron pong kumikirot sa incision natin or may nararamdaman po tayong any discomfort or pain, pwede po tayong mag-implement ng deep breathing exercise or ng any breathing techniques po to alleviate the pain or to provide comfort din po sa inyong sarili. So, for the prepositioning, after the patient has successfully moved to a comfortable position, ensure that the patient is properly aligned and supported with pillows. And also, we must also advise the patient to relax and rest before making or attempting any movement. So, ma'am, mag-relax lang po tayo and magpahinga po tayo para po mas mapabilis po yung pagaling natin and hindi na po magkaroon ng iba pang complications. And then, for education, what we must do is to educate the patient, for example, for the importance of doing the leg exercises consistently. So it is important po to mitigate any complications and to enhance circulation. So it is very important po to educate the patient in the procedure and to the outcomes and as well as to its importance. And then also, we must review po the restrictions or precautions regarding the specific surgery that is done with the patient and as well as the incisions. And then lastly po is we must offer the patient tips for implementing proper body mechanics po para sa daily living din po ng patient, hindi lang habang nandito siya sa under ng care natin, kundi pati na rin ng after paglabas po. And then lastly is after documenting all the relevant information, you must explain the critical thinking or the holistic nursing care to the patients. So holistic nursing care po is not only about taking care of the patient in his or her physical state, but also caring for the mental, emotional, physiological, and any other aspect of the well-being of the person po. So it is taking care of the patient as a whole with fundamental basic needs. So thank you so much po for your cooperation, and I wish you well.